You can do video. Okay. Well, I'm going to be embarrassed when I don't know what I'm talking. I started with the hardest one. Okay, so here we have the lower extremity. There's this vein. This is looking at it from the anterior legs splayed. So there's this vein that kind of separates these two muscles. This is the sartorius, and this is the gracilis. And that's about all you can see without having them dissected. So on this side, I have the students cut through the gracilis and the sartorius and remove them basically. So here's kind of some shreds of the sartorius, the gracilis. And sartorius, who knows, it's probably part of it there, but it's gone. So when you get in here then, you can see some other muscles, including some hamstrings. And I think we agreed this was the semimembranosus, and this the semitendinosus, so some good hamstrings. If we flip this over, actually let's flip this one over, because this one's still intact. We have the biceps femoris. Actually, this isn't that great because there's still some skin there. This is biceps femoris. Maybe we can see it over here if we kind of reassemble it. This was biceps femoris. I'm trying to figure out how it went back in there. Anyway, this is it. So collectively, these hamstrings, when they contract, they pull the leg back. In other words, they flex the knee. Let's see what else we can see over here. Okay, so since the biceps femoris was cut open here, we can see some of the quadriceps muscles. We're going to call this vastus lateralis. And if we look on the other side, we can see rectus femoris, another large quadriceps muscle. And vastus medialis, I'm not quite sure about. Maybe here's some threads of it in here. So the quadriceps, when they contract, they pull on the leg, so they extend the knee. What else have we got? Well, we can go down to the leg, and here's a nice anterior leg muscle, tibialis anterior. Here's the tibia. So tibialis anterior is a great name for this muscle, as it's anterior to the tibia, and this is a dorsiflexor of the foot. Let's see if I can make it do that. Well, yeah, a little bit. It's a little stiff because it's preserved. If we go to the posterior leg, we've got gastrocnemius. Deep to that, we've got soleus. Both of these insert into the calcaneal tendon, which is here. It's actually a really strong tendon. So it's also called the Achilles tendon. So these are plantar flexors of the foot. That works really nicely. I've got some other muscles in here, not really well isolated. This is probably fibularis longus. And I think that's about all we can see. Well, there's some deeper flexors in here. Maybe one of those is flexor digitorum longus, but don't worry about those for a quiz. I think that's about all I can say about the lower extremity. So you want to pause and we'll go to another